This can help to retrain the brain to understand that the movement is not dangerous, because imagining doing the movement can not hurt. You can basically trick your brain into giving you back the movement.
Neat.
Super good.
Yeah, so I'm just going to stop the screen share there. Okay, so what do you think for our
I
listeners?
thought it was great. I couldn't hear it very well, but I could read it, so that was fine.
Good.
I find it fascinating. I find our brains fascinating.
Yeah.
So I did like the fact that if there is some injury, a lot of people that you and I see have chronic injuries, chronic pain, and the longer we have it, the more of a mental drain it creates, because we think, oh, am I just going to have to live with this forever? Or, this is just the way it's going to be. And you and I know that that's not the case. And this is a great way to start implementing your own health and healing.
Yeah. And I think that's important, especially, when we talk online, and even more so in our office when we coach people through the steps to stay healthy or get back on track after a challenge. I think changing their perception of, oh, when I move, I get pain XYZ, right? Well, yes, we can give them the nudge to move more, but also we can also say, hey, practice and rehearse on your own mentally.
Yes, absolutely. Absolutely. So that goes to like a couple different things, like rehearsing on our own, moving in our brains, that injured part, going through a range of motion, noticing in our brain that it doesn't create pain, will help the body recover more quickly. The other thing is, again, perception. So even just saying, I'm thankful and grateful for my healing knee, ankle. The affirmations, just putting it out there that there is change happening and that it's all good. I think that's pretty impressive. We have to believe it, right? We have to believe that things are going to get better. I mean, how many times in your office, Dr. Matt, have you helped someone along their health journey and they said, oh my gosh, I just thought that it was going to be this way forever. Yeah. It's like they have a new lease on life, and who told them that? Who told them that it was going to be that way forever? But, we get locked into a perception when things don't heal right away that, oh, I guess I'm just getting older. Oh, I guess this is just the way it's going to be. And it doesn't have to be that way.
No, and I think it's important you can see yourself breaking through that plateau, right? And there's always the potential to make an improvement. So
how empowering is that? That's super empowering.
Which is huge, right, for the person.
Yeah.
I liked what you said, though, about affirmations, because really when you're doing the mental rehearsal, you're rewiring what's going on and your expectation. Same with the affirmations, the repetition changes your neurology, and you keep pruning and regrouping those pathways in your brain. And then you wanted to touch on cross-training, you said.
Yeah, so I remember this back from chiropractic college say you have an arm in a cast or a leg in a cast, there's science, and it goes right along with what we're saying here, that says that if you train the other side, the healthy side, you'll diminish atrophy in the or muscle wasting in the arm or like the leg that's casted or whatever. So, you see people come out of a leg cast and they get the skinny little chicken leg, and then they've got their, nice strong leg. Well, we can diminish even the effects of that by cross-training or, working on the other side of the body, and that will transfer through the brain into strengthening that casted or injured side.
Which I think I remember that well, actually, now that you brought that up. And I think that a lot of it, like, you'll still get some muscle atrophy, but the neural connections will still be firing.
Yes.
By training that other limb.
Yes. And so then when you go into physio or you go into rehabilitation or whatever, you're going to get that muscle back much more quickly. So you're going to bounce back.
Yes, and your coordination is going to be better. And I think that's going to be part of the role as well when I see people under chiropractic care. Their coordination, how they move and understand their body, and their awareness is typically higher.
Yes. Yeah. And improving proprioception too, right? Like not even just in that, like the video that we were watching, thinking through it is going to create a stronger connection between your brain and that part of the body, so that, if you're limping or hobbling or whatever the case may be, the brain is going to give you more information when you're training it. So our proprioception is going to be better.
And it does that through your nervous system, your spine.
Absolutely.
Yeah, which is the cool part and why we're looking forward to getting back on track with everybody.
Yes.
Yeah. Yeah.
This chiropractic stuff is awesome.
Yeah. I love it. I love it. Cool. Is there anything else you wanted to add before we sign off today?
No, I think we're good.
Cool. All right. We'll see you guys soon. Looking forward to seeing everybody, and have a great day. See you, Dr. Jenn.
Have a great day. Bye, Dr. Matt.
Bye, guys.